These lights are bright. Hi, everyone. Thanks for coming to the closing session for the World Conference on Lung Health 2025. Just wanted to hear, did anybody enjoy the week? Yeah? Awesome. Absolutely love hearing that, and absolutely love all the feedback that I've been getting as I've been stopped. Every time I try to go from one session to another, I end up missing my sessions because there's so many of you to speak to. So thank you for taking the time to be here, and thank you for taking the time to stay till the very end. I'd like to introduce now, we're going to start with the scientific and reflection section now, and I'd like to introduce Katharina Kranzer, who's the chair of our conference scientific committee, who will lead the next session. Thanks, Katharina.
Thank you very much, and thank you everybody for staying to the very, very last session, even if it's not as many people as at the opening. It's my great, great pleasure. This year we have chosen a bit of a different scientific reflection session. Usually we have rapporteur sessions, but this year I have three stakeholders, key stakeholders here on stage to provide us with some reflections of the conference in our first round. So what are the thoughts, what are the takeaways, what are the issues or conclusions you have drawn? And I will start off with Ashna Ashesh. She is from India and she is a lawyer, public health practitioner, but also an MDR-TB survivor. Thank you very much for joining us. The floor is yours.
Thank you for doing it. Thank you so much. Is this working? It's on? Yeah. Okay, great. Thank you. So in terms of learnings for me, what really stood out was we're looking at prevention very comprehensively now, and we're talking about TPT and the potential of LAIs and TPT, not just our standard TPT that exists. We're talking about vaccines, and that's all incredible. And the one thing that I sort of see us doing, but in silos and not in a very integrated way, is that we're not talking about the social vaccine. So this morning, Dr. Bhargav presented on nutrition. And in addition to adequate nutrition, the safe housing, there is a stable livelihood so that you have access to preventive health care. All of these factors sort of help us prevent TB. And particularly at this moment when there is a funding crisis and we really need to prioritize and optimize, I think it's worth considering that what we do not prevent today, we will have to treat tomorrow, and we don't have the resources for that like we did earlier. Not that we had many earlier, but now it's way worse. So yeah, I think we need to focus on a comprehensive model of prevention, not just a biomedical one. That's something I'd like to add. Thank you.
Thank you very much, and that is very timely. We are moving continents, so we are going to Brazil. Anete Trajman, she's a professor in clinical medicine, and she's actually has a clear focus. She's a researcher and academic, clear focus on prevention, which is really at the core of her work, not the only work she's doing, but I would really, and we will know, everybody knows the little secret, but why we have somebody from Brazil here, because it's also a bit of an outlook in the future. So we would like to hear from you. What is your takeaway from the conference?
Thank you, Katharina, for inviting me here. I have seen that this was an enlightening conference. We have seen many, many things, and I regret I couldn't be. There were not two of me, or three, to go to so many interesting sessions. But I've seen a lot, and I heard a lot about tongue swab, pooling, so opportunities to expand the access to molecular testing for many people. The expansion of use of CAD to detect earlier disease. Long-acting drugs, combination trials to combine various strategies for prevention. So not only the vaccine, but the social vaccine, nutrition, TPT. So there were many advances, but there are also many challenges. I think that there is an enormous gap between evidence and implementation. There are many countries in the world that are still using INH for TPT. many countries that are not using, don't have access to second-line drugs for DR treatment, especially the shorter regimens. We have heard Henry in the opening session. Thank you, John Green, and thank you all for inviting those people. We heard real stories of people who do not have access. That is unacceptable in 2025. So we have to advance on social protection, on primary health care, on truly not leave anyone behind. And that's only possible with social protection and universal health coverage.
Thank you very much. Yeah, and then we are coming back to Europe. We are very happy that Denmark and Copenhagen hosted us, and we had a lot of sessions about Europe, about topics which are pertinent for Europe, and we are very, very happy and grateful that Mr. Stephan Albani could join us, a member of the German Bundestag, and he has been really spearheading the cause of TB. He is the co-chair of the TB caucus, the European TB caucus. So it would be great to hear from a policymaker. Obviously, we are all in suspension on the Global Fund kind of pledges, which hopefully will come out later today. So we are looking forward to hearing from you.
Yes, thank you very much. And for you to understand what I will say, you have to take into acknowledge that I had a serious life before going to Parliament, which means I was a scientist in the area of medicine and physics. And therefore, joining such a Congress is for me like a fish going back to water. Thank you very much for these hours in water again, and I just can congratulate you for this wonderful Congress. And what I take with me is especially, beside what is said from these wonderful speakers beforehand, is the way how science, patients, supporting groups are working together in peace and constructively is a wonderful thing. I know this from my field, that in a lot of other fields in medicine we are working to achieve this, what you are living here. And as I heard, this is something you achieved within your work over years. And I can only congratulate that you achieved this, because as the scientists, we always say, okay, we are working for the ones who are suffering from the illness we are working on. But working together in a constructive way, like you are doing is in this Congress, is a wonderful thing. And please keep this and like a diamond, like something which is very worthy. And it was wonderful to be a part of it, although it was one day.
Thank you very much. So my second question, and we will keep it brief, but my second question is, what are we going to do? What are we going to do going forward? What is it what you want to tell all of these people in the room, what we should do? What is your call to action? And Ashna, over to you.
Thank you. So I'm going to keep it very brief. I think going forward, and this is something that's cross-cutting, community engagement needs to be more substantive and meaningful, and I'll just quickly elaborate on that. We keep saying communities should have a seat at this table, and by we, I'm including me. And I think that's inaccurate, because that's a little bit like going to someone's house for dinner and offering them a seat at their own table. In that we all can get TB because we breathe air. We are all in some way impacted community. This is our table. It belongs to all of us, clinicians, NTPs, affected communities, civil society, scientists, and we need to work together as partners with communities. So when we do capacity building, it needs to go both ways. We build capacity for the community, but we also learn from them and have our capacity built. And this cuts across then in policy making, in service delivery, in implementation. Working as partners with the affected community is the way forward. Thank you.
Thank you. as a scientist, what do we do next? What is it what we need to solve?
Well, a scientist is not outside of this world, right? So I would repeat the words of my colleagues. I think that political will, multilateral cooperation, not only between countries, but also inside the country, between the civil society, the academics, and our politicians and our managers. This is something we have learned in the past and we have to reinforce. I think that we need implementation trials to reduce the gap between the evidence and the policy. We need to study more accessible drugs, shorter regimens, both for TBT and for sensitive TB, and for susceptible TB, and for resistant TB. And I think that because we are not outside of the world, not only poverty is perpetuating TB, but also wars, conflicts, dictatorships, and genocides. And we need to do something and raise our voices to progress to peace and good
Prosperity.
Yes, exactly. So we are not just TB scientists. We are people. We are citizens, and we have to go beyond TB, because TB is a social disease. TB is not only Mycobacterium tuberculosis, right?
Thank you. We give the last word to you. What are you telling us to do, or how will the implementers and policymakers support us?
I will just add to what has been said and take the same picture as I used in the morning. When you sometimes look at the numbers, then you can be depressed because you perhaps sometimes say it's not going on, we are putting so much effort on it, and perhaps when you are living in this wonderful hotel and take the elevator and somebody has pressed the button and the light is on and the elevator does not come, there's always this strange person who presses again on the same button, thinking that the elevator may come faster. No, let me tell you this riddle, it will not come faster. No, you have to change paradigm. You have to change the way you work with it. You know this as a scientist when you change your approach within your research work. And I would just suggest to do this as well, addressing the policymakers. The one thing is the duty, saying what it means as a social disease, what it means for the other way is how befriedigend, how great, satisfying it can be to help the people, to help the scientists to overcome, and so on and so forth, to change it from the moral side and the duty side to the side, how fun it can be to work together with the union and to give them the money they need for a good science. And so a good and happy face is happier to give the money within the global fund on something like that. So when you say at the elevator, please do not press the same button again, change and find the staircases and try to address the policymakers, perhaps in another way. Thank you very much.
Thank you very much. Thank you, everybody, for joining us. I will hand back, Cassandra, to you. And I think it's awards ceremony. Thank you.
Thank you.
I don't think I've ever been to a scientific conference that gives out hugs as much as I see giving out here. I just think we should all reflect on that. It's a very important piece, I think, to the Union Conference. Thank you very much for those insightful reflections. I think it was a very different format, and I really appreciated the diversity of the reflections that you all brought. And I think it's a testament, that diversity that we just saw on stage now, it's a testament to the diversity that you've all been experiencing for the past 4 days. And really the fact that we're bringing together the entirety of the lung health community. We're not bringing together a piece, but we're bringing together the fabric of the lung health community. And so a big thank you to those reflections earlier. I want to thank you all for prioritizing your attendance. I know this year has been a roller coaster, if that's the best description that we can come up with. It's been a ride that I don't think any of us wanted to be on or want to repeat. So the fact that you prioritized your funds, your time, your brain space, your capacity, and your love, and your willingness to keep fighting for TB and ending TB, I think really deserves a round of applause for everybody here. I really want to comment on the fact that this year in March or April, we were unsure how many of you we would get to see. And we have had the absolute privilege of welcoming 3,300 delegates to this year's conference, both in Copenhagen and online. It's really an absolute tremendous dedication to TB from you all. We had 120 countries represented. Again, that really just speaks to the commitment for diversity of voice and diversity of the data and the sharing and the knowledge sharing that we bring to the week. I think for me, the last 4 days have really validated the fact that we're right. We are not going to be silenced. We may not be okay with the voices that we're surrounded by on a daily basis, and we may forget the fact that actually what we do matters. The evidence that we generate counts. Your voice can be heard. We can continue to work together and support each other to try to bring an end to TB in our generation, not later. I really think that this strengthening of our resolve and my resolve personally to continue on this fight has really been strengthened by everything that you all brought to the conference, all the voices, all the opinions, all the sharing of the data, the constructive dialogue between all of the different stakeholders that make up our lung health community. I think we must stand up for our vision, our values, our beliefs, and our collective vision that we can bring about an end to TB. We have learned this week that there are mechanisms for us to be heard, and we've heard about a diversity of those mechanisms. And we can use those platforms for good across building our next leaders, but also making sure that we continue to engage with each other in very constructive and very mobilizing ways. I'm excited by the scope of advancements that were presented this week. I heard a couple of people say this was the year of the swab, which means that we're talking about innovations, we're talking about change, we're talking about something that didn't get talked about last year. And that is the point of the Union Conference. I think we need to apply this new knowledge that we've taken away in our daily work and make sure that we're really understanding how we can bring about change by next year, but also so that it can be lasting and impactful. So now I'd like to shift just a second and say thank you. I'd like to thank all of the people that put this incredible conference together. First, I'd like to say a massive thank you to the Union's Conference Scientific Committee, led by Katharina Kranzer. The amount of work that went into curating all of the amazing abstract submissions and putting together the scientific content really deserves a round of applause. Thank you. I'd also like to thank the Union Community Advisory Panel for bringing your voice and making sure that you've held us all accountable to providing a space that actually allows for dialogue and interaction. The TB Scientific Committee also helped to curate our content, and for that, thank you. The conference subcommittee of the board did an immeasurable amount of work throughout the year, taking hard decisions and decisions that really led to the quality of the week that you have in front of you. And a big thank you to the Union Conference team, whose dedication and resolve to making sure that this was a smooth conference that everybody has a lot of good smiles and memories from. Thank you. I would be remiss if I did not thank the number of volunteers that we had who kindly donated their time to help to shepherd you to the right place, make sure that we know who's attending which sessions, and maybe to prevent me from going where I wasn't supposed to go. So I very much appreciate that. And finally, I'd like to say a huge thank you to all of the advocates, our affected communities, and all of the others that have really shared their personal stories and voices that really bring home why we do what we do and how we do it all together. We're connecting the science and the innovation to those most affected by the diseases, and it keeps us grounded in why we work, where we work, and how we work. Thank you. A thank you also to our exhibitors, our sponsors, and our donors. Each of you have contributed in an immeasurable way to make sure that this conference was able to be put on this year. And without that financial and strategic support, we would not have been where we are today. So thank you. It is now my honor to switch gears and present the first ever Early Career Researcher Award, which was supported by Johnson & Johnson. And this year's award was a very tough decision. It is in recognition of outstanding and promising early career researchers and studies in the field of TB and lung health broadly. The winner was selected from the fantastic RIT JADA Student Late Breaker session on lung health. And I am glad to say I did not have to make the selection, but I get the absolute pleasure of announcing the winner. The winner is Jane Ellis, who presented on, yes? Jane presented on TB and cytomegalovirus co-pathogenicity amongst adults with cryptococcal meningitis, a prospective cohort study. Unfortunately, Jane has already had to leave, and so we're going to ask her colleague, Layla Larson, to come up and accept the award on her behalf. As well as the certificate, Jane will be awarded with a full scholarship for the Union World Conference on Lung Health 2026. I won't say where. I'll leave that till later. And open access fees support as well to be able to publish in the Union Journal. Next award is the Princess Chichibu Memorial TB Global Award, recognizing outstanding contributions to the global TB control. The award will be presented by Saya Kato, Director of the Research Institute of Tuberculosis, the Japan Anti-Tuberculosis Association.
Ladies and gentlemen, it is my honor and pleasure to present the Princess Chichibu Memorial Global TB Award today at this ceremony on behalf of Her Imperial Crown Highness Princess Akishino, the patroness of the Japan Anti-Tuberculosis Association. Since 1998, Japan Anti-Tuberculosis Association has presented this award annually at the World Conference on Lung Health in collaboration with the Union to recognize distinguished achievement in international anti-tuberculosis activities. Please allow us to briefly introduce the background of this award. Her Imperial Highness Princess Chichibu was a patroness of JADA from its foundation in 1939. Shortly after she started serving as a patroness, her husband, Prince Chichibu, a brother of the previous emperor, contracted TB and passed away after struggling with the disease for more than 10 years. Because of this sad experience, Princess Chichibu devoted her life to the prevention of TB. This award was initiated based on her will to make the world free of TB. This year, Professor Katharina is honored for his exceptional contribution to global TB control through groundbreaking research, clinical leadership, and policy impact. His pioneering work on rapid molecular diagnostics and the urine alarm test has transformed TB diagnosis and served countless lives across Africa. As a globally recognized scientist and mentor, Professor Data has advanced the understanding of drug-resistant TB while building research and clinical capacity in resource-limited settings. His evidence-based, socially responsive approach continues to influence WHO guidelines and national TB strategy, making a lasting impact on global health. On behalf of JATA, I'd like to invite Professor Katharina to receive this award for his outstanding contribution to global TB control and prevention. Professor Data, would you please come forward to accept this year's award? Congratulations. Thank you very much.
Thank you very much, and congratulations, Prof. Data. I'd now like to invite Karen Middlecoop to present the Karel Styblo Public Health Prize.
Thank you. The prestigious Karel Styblo Public Health Prize acknowledges a health worker or community organization for public health contributions to TB control over a period of 10 years or more. This prize is named in honor of Dr. Karel Styblo, who was Director of Scientific Activities here at the Union from 1979 to 1991. Dr. Styblo played a central role in developing the Union TB control model that was later branded by WHO as DOTS. This award has not been presented since 2020, and so I'm thrilled that we have been able to bring it back again this year. The nominees are submitted by our membership and were scored by the section and regional chairs. And the chairs had a tough job. I know we always say this, but I can attest, having seen the scores, that the chairs had a tough job selecting a winner from incredibly high caliber submissions. This year's winners are both institutions that have made significant contributions to our efforts to end TB and lung disease. And the winners this year are the Desmond Tutu TB Centre in South Africa, and the former TB division of USAID. The Desmond Tutu TB Centre has established itself as a sustained, high-impact contributor to TB over the past 20 years. They deliver a comprehensive program of research, policy engagement, capacity building, and community work that, together, have measurably advanced TB control. The Centre's work has been particularly influential in the field of adolescent and pediatric TB, which I think we can all agree is a historically neglected area within TB policy and practice. Despite the abrupt end to USAID global funding, the long-standing commitment and the support by the former USAID TB division, and its remarkable achievements in the fight against TB through exceptional country and global partnership will remain a formidable legacy in contributing to the WHO and TB strategy. So now I'm delighted to invite Susan Purchase from the Desmond Tutu TB Centre and Sherry Vincent, former chief of the USAID TB division, to come accept their awards and say a few words if they wish.
So union colleagues and members of the global TB community, thank you. It's an extraordinary honor for the Stellenbosch University Desmond Tutu TB Centre to receive the Karel Styblo Award. I'd like to start by sharing Anneke's apologies. She would have loved to be here, but she flew to London today and she was unable to make last-minute changes to her flight. So this award carries the name of a visionary who believed deeply in science, but science anchored in compassion and communities. And his legacy reminds us that the fight against TB is not only about epidemiology and data, but it's about dignity, equity, and the belief that every person deserves the chance to live a healthy life. And we're humbled to be associated with his legacy today. At the Desmond Tutu TB Centre, our work is guided by the communities of Cape Town, of South Africa, of the African continent. And we really share this award with the families who've opened their homes to research, the health workers who walk from door to door, and the TB sufferers who inspire us with their courage and their honesty. We also share the award with TB research legends who've gone before us. Our achievements have been built on decades of investment, dedication, and passion from South African TB researchers, and we truly have stood on the shoulders of giants. And lastly, we honor the life and teaching of Archbishop Desmond Tutu, whose name we carry with pride. His message, that hope is a discipline, and that we're each called to make the world more just, continues to shape our science and our service. So our motto at Desmond Tutu is that every breath counts, and we aim to conduct research that includes vulnerable communities and addresses each step in the care cascade. We're proud of the fact that our research has changed WHO guidelines, and despite COVID and severe funding challenges over this last year, we remain committed to capacity building and training and to conducting relevant grassroots research in the decades to come. And so to our partners and collaborators and funders, thank you for believing in locally driven African research and the power of collective action. And to our staff, our nurses, study coordinators, field workers, support teams, this award belongs to you. So as we accept this, we really renew our commitment to our vision of a TB-free world for the next generation, where innovation is accessible, where communities are empowered, and where no adult, child, or pregnant woman is left behind. Thank you.
Wow, the slate is bright. I'd like to ask my other former USAID colleagues to come up here with me. We have a few people here. I'd like to start to thank the union and the award selection committee organizers. As you said, it was, I'm sure, very difficult. But I'm honored to be here speaking on behalf of the former USAID TB team around the world. As you can see, there's a few of us here today, and we are all accepting this award in our personal capacity.
This particular award, Karel Styblo Public Health Award, is really fitting for many of us because we worked so closely with the Dutch and Kane CV for so many years to save so many lives. I would say several decades, honestly. And so we're happy that the results have saved those that we see today and that you have seen during the conference. And I know you've all spent the last few days at this conference talking about all the amazing advancements, and so I won't go into that today. I do have a few points I want to make. It's really heartening to see the resilience of this community. I know that it was mentioned earlier, but for us to see that all of this continues and these results continue, because the work must continue. Despite anything that happens, we all must continue on. And there's so much needs to be done still. So we, despite these unfortunate situations, that we want to be part of that. And I would like to apologize to all of you or any of you that have been affected by the disruptions that have happened. Our team is certainly grieving, but we are also keeping up the fight in different ways. The fight against TB wasn't a job for us. It was and remains a lifelong calling and commitment, and we will continue. So I'd like to ask, I can't really see very well with all these lights, but I'd like to ask to do something that was inspired by a former colleague to really show the reach and contributions of this award. So I ask that those of you that ever worked directly for USAID to please stand and stay standing. So if you ever worked for USAID. I know there's not many people here left. Then I'd like to ask those of you that received a USAID-funded salary at any time in your career, please join those standing and stay standing. And then I'd like to ask those of you that worked for any organization that was ever funded by USAID to please join those standing and stay standing. And lastly, those of you that collaborated with our former USAID TB team at any point in your career, please join those standing. So I think you can look around. This is a depth of the community. This award is also for you. We applaud you all as well in the work that has been done. So please keep up the amazing work. We are by your side all the way. Let this award be the fuel that propels us to carry on the amazing work and to finish the fight. So thank you all for being part of that community. And
I think everybody deserves one more round of applause. Thank you for all of the tireless dedication and the continuing commitment to everybody that's been impacted. Thank you very much. Now we're going to pivot to, and this is actually difficult because this week there's been a lot of special and favorite parts for the week for me, but this still remains my favorite part of the Union Conference. It's the Christmas Seals exhibition and contest. I had the very short honor of being able to present last year, but to this year I'm handing it back to a fellow Christmas Seals fanatic, Dean Schaffnagel.
And now, what everybody has been waiting for, the 2025 Christmas Seals Award. Oh boy, I don't think I can read that. From the one over there. A ragged newsboy darted through the throngs milling around the Philadelphia post office and dashed up to the booth where the Christmas seals were sold. Standing on his tiptoes, he pushed his precious penny across the counter and demanded, "Give me one. My sister's got it." This was in 1907. But today, in Copenhagen, we are commemorating a world-changing event. So, a brief history of tuberculosis. In the 1860s, it was discovered to be contagious. In 1882, the cause was discovered. And in the 1890s, people developed a sanatorium to cure and isolate patients with TB. And you can see on this graph that tuberculosis rates fell long before we had chemotherapy. The number of sanitariums, the number of SANs that were mushroomed. And you can see here, it started in 1904. There were 8,000 beds. By the peak in 1953, there were 136,000 fully operating beds treating patients with tuberculosis. But there was a problem. How to pay for these? Some sanitaria had to close and deny patients treatment. A funding crisis. Now, I think we might be aware of funding crises. But this funding crisis was addressed by a postal worker here in Copenhagen. In 1904, Einar Hobal was a postal clerk and said, what if we create a stamp that's less than a penny, and we can put it on the envelope, and it will go to fund our SAN, our local SAN, and keep it from closing. He's talked to his postal workers. They said, great idea. Let's see if we can get the government, the king. So they went to the king, and he said, great idea. So the first stamp, Christmas stamp, is up there with the late Queen Louisa on it. And it's sold in the post offices, just like the boy in the first paragraph that I read. And it was an overwhelming success, so successful that it was multiple of what was needed for keeping open that SAN. Within a few years, many countries developed the seals, and seals in the 20th century really funded the major part of tuberculosis care and research, and in fact are responsible for the anti-tuberculosis organizations that you've heard of today, and including our union. So enough of the preamble. We'll get to the major topic. And how can we, so the Christmas seals, the contestants are, I can't see, I have to look this way. The Hong Kong Tuberculosis, Chest, and Heart Diseases Association, Japan Anti-Tuberculosis Association, Korean National Tuberculosis Association, Philippine Tuberculosis Society, Taiwan Anti-Tuberculosis Association, and the Tuberculosis Association of India. Envelope, please. And the third prize goes to the Japan Anti-Tuberculosis Association. And the second, and the second prize goes to the Korean National Tuberculosis Association. And now what you've been waiting for. The first prize goes to the Taiwan Anti-Tuberculosis Association. And we want to say a special thanks to all of the organizations that promote SEALs for supporting research not only this year but through the last century. Thank you very much.
All right, folks, just a little bit longer. Hang in there. We have a very exciting announcement to make. It's the best kept secret of the week. Please join me in welcoming to the stage the hosts of the Union World Conference on Lung Health 2026.
Not anymore a surprise. Many people came to me excited and I said, how do you know? You know, I did pretend to be a surprise. Well, thank you, Fernanda, to be here with me and you, Carlos, as well. Excellencies, distinguished participants, ladies and gentlemen, my esteemed colleagues from the Ministry of Health of Brazil, dear old and inspiring friends that gave me the pleasure of this gathering again after a while. Let me begin by thanking you, Professor Guy Marks, Cassandra Kelly-Cirino, and the Union team for the remarkable work and arrangements throughout this conference, and Copenhagen for the very generous hospitality extended to all of us. By hosting a truly phenomenal World Conference on Lung Health this year, you have set a standard of excellence, thus, that has reignited our purpose and redefined our ambition to host this meeting in Brazil, precisely in Rio de Janeiro. I also wish to use this opportunity to extend the regret of the Minister of Health of Brazil, His Excellency Dr. Alexandre Padilha, for being unable to attend this session, actually in spite of his strong wish to participate. Actually, we have been together in the recent days in the COP30, facing fruitful discussions about health challenges in Brazil and the world and relevant actions to overcome them. I join him on behalf of our Minister of Health in expressing the full confidence in our collective ability to bring this conference to a productive and successful edition in 26 in the city of Rio de Janeiro. For this, federal and local health authorities have agreed in this endeavor. Dear friends, we accept this great responsibility with a determination. Brazilians are very determined, as you know, to survive, to host not only an event, but a global inflection point in terms of tuberculosis and other respiratory diseases. We are grateful for the trust placed in us. We have spent these last days delving into science, policies, the compelling possibilities, and the possible solutions. We, for sure, leave this room intellectually richer But why readily identifiable and treatable lung diseases still inflict such immense, measurable damage on individuals, families, and in nations? The tragic persistence of these epidemics is not a failure of knowledge. We all are aware that we must transform these integrated priorities into rights, not privileges. Brazil, as a vast, diverse, and institutionally robust nation, fully understands the complexity of this challenge. Our public health system is committed to universal access, and this commitment gives us a unique perspective, as you might know. It does not escape us the harsh reality we face in the fight against these diseases, particularly in eliminating or attempting to eliminate tuberculosis, which still impacts our most vulnerable communities. However, I want to reaffirm here our profound dedication and unwavering commitment to scaling up our efforts, leveraging our national health system and mobilizing every necessary resources to finally overcome these burdens. We are excited to see another year around of growing scientific leapfrogging and technological development to push the boundaries of what is possible. We will keep fostering truly multi-sectoral collaboration that transcends government walls and engages civil society, private sector, and community leaders through the critical participation of our civil society. In this sense, it is also important to note that Brazil has a long proven history of recognizing and actively ensuring the vital role of civil society in the definition and monitoring of public health policies and guidelines development. And the upcoming conference in Rio will be a crucial opportunity to further strengthen this history, ensuring that these voices remain at the very heart of the program as well as actions taken. Dear colleagues, as I wrap up my remarks, allow me to say that I see many faces here ready for another period of intensive work. I mean researchers, health professionals, community leaders, people that lived experience with the diseases, and partners for every region. Your resilience and unwavering commitment are the reason we can speak today of progress and not only of loss. We in Brazil, too, will dedicate ourselves entirely to ensuring the 26th Union Conference is a productive and impactful gathering. We know that too often discussions at international meetings are not implemented with the speed our people deserve. We hear loud and clear, we understand, but cannot accept the gap between words and reality. Thus, we have all the conditions for success in Rio: a generous and welcoming people, deep and engaged scientific expertise, and the political will from the Minister of Health to support meaningful change. We look forward to welcoming you all to join not only a conference, but an action, equity-oriented movement. Once again, I thank the organizers of this year's conference, Denmark in particular, and all of you who have contributed so much these days. Thank you very much, and welcome to Rio.
Thank you very much. And before you pack away your puffer jackets and put your flip-flops on, I just want a couple more minutes of your time. I'd like to say thank you very much to the City of Copenhagen and to Denmark for hosting us this year. We very much look forward to coming to Rio next year. So we're going to wrap up now. We're going to watch a little video of some of the highlights of the week in case you're already feeling nostalgic as you start to pack your bags. But one last thing from me. Tak and obrigado. See you in Rio.
It's my first union conference to attend, so I'm super excited.
The amount of energy that the different presenters have, so driven, it's really difficult not to be influenced by them.
Actually, it is my first snowing in my life, so I'm very excited to see snowing.
It's spectacular in Union. We get a lot of things to learn, getting connections, and it's pretty exciting for me.
I wanted to present my abstract, my first abstract actually, so it's been so exciting and the event is so insightful for me.
All of the new technologies that have come out in this last year has been amazing, and I really feel that for public health, it will take us to another level of what we were not thinking of. It's now pushed us to a place where we need to be more efficient, more effective, and ensure that everything works full circle.
These systems that we're doing for TB and lung health are building the surveillance capacity at community level.
We are focused, we are determined, we're consistent. Stopping TB from happening in our environment. It's not just talk the talk, but do the do, walk the walk. That's what we really want to do.
I think the key word here is collaboration, where we put all our resources together. The private healthcare companies, the pharma companies, the public sector, the hospitals all around. Put our efforts together and try to help this agenda move forward. And conferences like this will help put a focus on it, will help bring people who have the solutions together.
My grandfather, I think he would have encouraged people to continue developing new drugs, and I know that there is a lot of effort to do that. I think he would have been a great source of inspiration to all those people.
I think seeing people who are invested in advocacy and social justice that goes beyond the moment, that is what I'm seeing here. All of these people are in it for the long game, so it's heartening to see there are people that invested in a single cause.
In Brazil, we are very happy to have the conference in Union there. It will be very important for us to show the country on opportunities, to show the communities in Brazil about tuberculosis, the importance of the huge conference there.
Thank you for taking the time to be here, and thank you for taking the time to stay till the very end.